Have you ever been told that blood thinners automatically mean you'll be dealing with constant bleeding or bruising after 70? For many older adults, the thought of taking these medications can be terrifying. You might picture yourself bruising at the slightest touch or winding up in the hospital from a minor cut. It's understandable to worry, especially when you've heard anecdotes from friends or read alarming headlines. But here's the good news. Believing that all blood thinners inevitably lead to major bleeding is not just overly simplistic. It can be downright misleading. And when you shy away from a treatment that might help protect you from serious problems like strokes or dangerous blood clots, you could be putting yourself at unnecessary risk. Many seniors feel stuck in a difficult position. They want to stay active and maintain their independence, but they're concerned that a single fall or small injury could turn disastrous if they're on blood thinners. Yet the reality is more nuanced than bleeding all the time. Over the last few decades, healthcare professionals have gained a deeper understanding of how these medications work and have developed strategies to help reduce the risks while boosting the benefits. You deserve to hear a balanced perspective that respects your valid concerns, yet provides reassurance that not all blood-thinning medications pose the same challenges. Why is this conversation so important? When you have information based on fear or incomplete understanding, it can keep you from making decisions that protect your heart, your brain, and your overall well-being. Some seniors miss out on critical treatments that could improve or even save their lives because they've accepted the all blood thinners are bad narrative without question. Others might continue with a prescription they don't fully understand, never realizing that lifestyle adjustments and regular checkups can make a world of difference in how their bodies respond. By clarifying the truth about blood thinners, we're talking about safeguarding your mobility, your ability to do the activities you love, and possibly adding healthy years to your life. Throughout the next few minutes, you'll discover why not all blood thinners are created equal, how healthcare providers strive to tailor medication plans, and what you can do right now to minimize potential side effects. Even more importantly, you'll learn how to communicate effectively with your healthcare team so that you can help shape a treatment plan that fits your personal goals and comfort level. Imagine the relief of finally having a clear perspective on these medications, knowing that you can manage your risks responsibly rather than feeling at the mercy of them. By the end of this talk, you'll see a path forward that embraces both safety and peace of mind. I'm here as an informed guide, combining both current medical wisdom and years of observing older adults navigate these exact decisions. While I'm not a doctor, I've consulted with healthcare professionals who focus on senior well-being, and I've seen many individuals over 70 discover that thoughtful, personalized use of blood thinners can actually keep them safer. At the same time, they've learned to watch for warning signs and manage small risks so that they can stay in charge of their health. As you listen, keep in mind your own lifestyle, preferences, and unique challenges. No two people are exactly alike, and you have every right to ask questions and tailor your treatment plan. Before we dive in, think about how much stress you've carried around the topic of blood thinners. If you've worried that you'd lose your independence or have to wrap yourself in bubble wrap just to feel secure, you're about to discover that there are far more empowering strategies available to you. Let's jump in and uncover a healthier, more confident way to view blood thinners after 70. First, let's address the core misunderstanding so many of us carry about blood thinners and bleeding risks. Point 1. Challenging the all blood thinners are the same mindset. A big stumbling block for many older adults is the belief that all blood thinners operate in the same way, and that all of them pose the same bleeding risk. This misconception often arises because the term blood thinner sounds like a single category. In reality, these medications can work differently and be prescribed for very specific reasons. There's a world of difference between drugs that reduce platelet stickiness and those that slow the blood's clotting ability. Yet seniors often lump them all together, imagining a universal risk of uncontrollable bleeding from even minor cuts. Consider Margaret, who's 74 and active in her gardening club. A year ago, she was advised to start taking a medication to prevent blood clots because she had an irregular heartbeat, a condition known as atrial fibrillation. Terrified that she would start bleeding whenever she trimmed her roses, she put off her prescription, even though her risk of stroke was relatively high. Margaret had lumped all blood thinners into the same scary basket and assumed any bruising or tiny scrape could become disastrous. But as her doctor gently explained, there are different categories: anti-coagulants and antiplatelets. Anticoagulants work on clotting factors in your blood, while antiplatelets focus on preventing your platelets from clumping together. Each category has unique features and varying levels of bleeding risk. What Margaret learned is that if you're informed about the type of blood thinner you're on, you can make better decisions. You might ask your healthcare provider how your medication compares to others and why it's the right fit for your condition. Some anticoagulants are known for effective stroke prevention with certain conditions, while antiplatelet drugs might be crucial if you have stents in your arteries or a history of heart disease. Rather than being paralyzed by fear, understanding that there are multiple approaches can lift a huge weight off your shoulders. So practically speaking, what should you do? First, ask your doctor or pharmacist to clarify which category your medication falls into and why it was chosen for you. Don't hesitate to speak up if you have concerns about bruising or past bleeding episodes. Many times, doctors can adjust dosages or switch to newer generation medications that have more predictable effects. In some cases, you might even have access to reversal agents, medications that quickly counteract the blood thinning effect if you ever need surgery or encounter a serious injury. Emotionally, knowing that each blood thinner is carefully matched to your specific heart condition or other health issues can give you a sense of control. It's like recognizing that not all shoes give you blisters. Some are just a better fit than others. The sense of relief you can gain from realizing you aren't at equal risk with every possible blood-thinning medication is enormous. This knowledge can free you to live your daily life more fully, rather than fearing every small bump or nick. By distinguishing between different kinds of blood thinners, you'll be able to ask targeted questions at your next doctor's appointment. This small shift in understanding can be the first step toward a safer, more comfortable experience with these medications. Before we move on, take a moment to reflect. Have you ever assumed that one blood thinner is just as risky as the next? Now's a good time to break that habit and see that nuance matters. Let's build on this to see why your individual situation plays a huge role in how you handle these treatments. Point 2, recognizing that bleeding risk is individual, not universal. It's easy to hear horror stories from friends and assume you'll have the exact same fate if you start taking a blood thinner. But in truth, bleeding risk varies significantly from person to person. Your overall health, family history, diet, and whether you have certain pre-existing conditions all play a role. Some older adults might indeed bruise more easily or bleed a little longer from cuts, but that doesn't automatically translate to severe or life-threatening situations. Walter is 77 and has been on a low-dose anticoagulant since he had a small stroke 2 years ago. He used to fret over every little bump, imagining it would lead to a marathon nosebleed. But after discussing his concerns with his doctor, Walter learned that people with well-managed blood pressure and stable kidney function often have fewer complications. He also discovered that being mindful of his alcohol consumption and maintaining a healthy weight could further reduce his bleeding risk. Over time, Walter found that occasional bruising was manageable and far from the catastrophe he initially imagined. One of the biggest myths among seniors is that you'll bleed uncontrollably from tiny injuries. If you're in generally good health and follow basic safety precautions, minor cuts usually clot just fine, maybe a bit slower, but not wildly out of control. Often, the real risk of bleeding becomes a concern in specific cases. For example, if you fall and hit your head, or if you develop a stomach ulcer. That's why communicating regularly with your healthcare provider is crucial. They can help you assess whether you have risk factors that make bleeding more of a concern, such as a history of gastrointestinal issues or a tendency toward falls. What can you do to lower your personal risk? First, keep an updated list of all your medications, including over-the-counter drugs and supplements. Many seniors overlook things like aspirin or certain herbal remedies that can also thin your blood, increasing the overall effect. Next, focus on managing conditions like high blood pressure or diabetes, which can compound bleeding risks when mixed with blood thinners. That often means staying on top of your routine checkups, monitoring your blood pressure at home, and making lifestyle adjustments like reducing sodium intake or adding gentle exercise that helps stabilize your cardiovascular health. From an emotional standpoint, customizing your approach to blood thinners can help you feel more secure. Think about it like choosing a diet that suits your needs. Some people do better with higher protein, others with more fiber. In the same way, understanding your particular health profile means you can shape your medication routine, diet, and precautions around what truly keeps you safe, not what might affect someone else. Before we continue, consider your own experience. Have you ever believed you were at high risk simply because a friend or family member had a bad experience on a blood thinner? Remember, you're a unique individual. Different factors influence how you respond, and there are practical ways to keep bleeding risks in check. In a moment, we'll explore the day-to-day habits that can make using blood thinners feel less scary and more empowering. But first, I'd love for you to think about whether you're fully aware of your personal risk factors. Could you name them if asked? If not, that's your cue to start the conversation with your doctor. Point 3. Simple lifestyle tweaks that minimize bleeding concerns. The notion that you have to tiptoe through life while on blood thinners is a major reason some seniors refuse or stop these medications prematurely. Yet with a few mindful adjustments, many older adults carry on with their usual activities, whether that's gardening, playing with the grandkids, or even moderate exercise. It's not about becoming a fragile version of yourself. It's about being smart with daily routines. Take Alice, 82, who's on an anti-platelet medication after a heart stent procedure. At first, she was terrified to go back to her morning walks on a nearby trail, picturing herself tripping over a root and experiencing uncontrollable bleeding. Instead of giving up her favorite activity, Alice talked to a physical therapist who recommended a walking stick for added stability on uneven surfaces. She also invested in sturdy, supportive shoes. After a month of cautious but regular walks, Alice felt more confident and realized she could still enjoy the outdoors without living in constant fear. One of the best lifestyle habits you can adopt is a routine for checking your skin, especially if you're prone to bruising. A quick glance at your arms, legs, and torso daily can alert you to new bruises or prolonged discoloration, letting you catch any issues early. Some seniors also find it helpful to use an electric razor rather than a blade, and to trim their nails carefully or let a family member help if dexterity is an issue. These small steps can reduce nicks and cuts while allowing you to maintain independence. Another overlooked but crucial factor is staying properly hydrated and maintaining a balanced diet. When your body is well nourished, you're in a better position to heal from minor injuries. Also, certain foods like leafy greens can contain vitamin K, which plays a role in blood clotting. So talk to your doctor about how much is safe to consume in your situation. This doesn't mean you have to avoid all vegetables if you're on an anticoagulant. It just means consistency is key. Sudden changes in your diet can interact with your medication, so a steady approach is far better than extreme swings. Perhaps most importantly, consider gentle strength and balance exercises. Light resistance training, Tai Chi, or even chair yoga can help improve muscle tone and reduce the likelihood of falls. The stronger and more coordinated you are, the lower your chance of serious injury. This not only supports your physical well-being, but also offers an emotional boost. Every time you complete a simple exercise session, you're reinforcing the fact that you have control over your health. Take a moment to think. Which parts of your daily life make you most nervous about bleeding? Is it cooking in the kitchen or taking walks on uneven sidewalks? Could you adopt safety measures, a better pair of shoes, special gloves for gardening, or even rearranging furniture to reduce trip hazards? These tweaks don't mean surrendering your freedom. They mean reclaiming it in a safer, more aware way. With each change, you're telling yourself that you can protect your independence while still enjoying life. Let's pause to reflect. So far, we've tackled why not all blood thinners are equal, why risk levels differ among individuals, and how simple habits can significantly lower your chances of problematic bleeding. Which step feels most doable for you right now? Learning more about your specific medication, customizing your environment for safety, or asking your doctor about how your diet might interact with your medication? Pick one small action and commit to exploring it this week. Point 4. Partnering with your healthcare team for monitoring and adjustments. If there's one critical truth about blood thinners, it's that they're not a set-it-and-forget-it deal. Ongoing monitoring and open communication with your healthcare team can make a massive difference in how well you tolerate your medication and how well it protects you. It's natural to feel a bit overwhelmed by this prospect. After all, who wants to spend more time at the doctor's office or getting blood tests? But think of it as an investment in your independence and peace of mind. Consider Harold, a 76-year-old who started on a newer type of anticoagulant. Initially, he was told that regular blood draws were less frequent with this medication than with older drugs. But Harold began noticing unusual bruising on his arms after his daily walks. Instead of ignoring this, he called his nurse practitioner, who scheduled him for a quick visit to check his lab values. They discovered he needed a slight dose adjustment. Within a week, his bruising subsided, and he felt more confident continuing his walks. By speaking up and getting that small tweak, Harold avoided more serious problems later on. Regular monitoring doesn't always mean weekly or monthly blood tests these days, especially if you're on certain modern medications. But it does mean staying alert to any changes in your body. Notice a new rash, a persistent nosebleed, more fatigue than usual? These could all be signals worth discussing with your doctor or pharmacist. Keeping a simple health journal, just a few lines each day about how you feel, can be incredibly useful. It provides a record you can share at appointments, helping your medical team identify patterns and make adjustments faster. Another aspect of working with your healthcare team is reviewing all your medications periodically. Many seniors take multiple prescriptions, from blood pressure meds to vitamins to pain relievers. When combined with a blood thinner, some of these can amplify bleeding risks or reduce effectiveness. A thorough medication review at least once a year can catch potentially harmful interactions. If you find yourself feeling hesitant or rushed during appointments, remember that asking questions is your right. Bring a friend or family member if you feel more comfortable that way. From an emotional standpoint, a good relationship with your healthcare providers means you won't feel alone in this journey. You'll have professionals who understand your medical history, can reassure you when you're anxious, and will help you strike the right balance between safety and freedom. It's easy to think of blood thinners as a burden that only you carry, but truly, you have a team behind you. Your doctor, nurse, pharmacist, and often even health coaches or rehabilitation specialists. Now consider how often you communicate with your healthcare team. Do you bring up concerns as soon as they arise, or wait until your next scheduled appointment, even if it's months away? A single phone call or message can sometimes prevent a small issue from becoming a big one. Take a moment to jot down any questions you might have about how frequently you need blood tests or what signs to watch for. Having that list ready makes your next conversation with your doctor much more productive. Let's see how all these pieces come together in making an informed decision about your medication plan. Point 5. Making an informed, confident decision with your doctor. Ultimately, whether you should start or continue on a blood thinner is not a one-size-fits-all question. It's a decision that ideally involves you as an active participant. When you grasp that blood thinners come in various forms, that your personal risk factors matter, that small lifestyle changes can reduce bleeding risks, and that monitoring is crucial, you're better positioned to talk with your doctor in a calm, informed manner. Let's look at Carl, who recently turned 80. He'd heard conflicting stories. One friend claimed blood thinners were lifesavers. Another insisted they were too dangerous to bother with. Carl felt torn, so he laid out his situation at an appointment with his primary care physician. He learned that his stroke risk was moderate due to a heart rhythm issue, but he also had a history of gastrointestinal bleeding. After consulting a specialist, they decided on a lower dose of a specific anticoagulant and scheduled routine checkups. Carl also agreed to limit alcohol and manage his acid reflux carefully, as these measures would reduce his chance of another GI bleed. In the end, Carl felt confident and safe because the choice was tailored to him, rather than following a blanket guideline or a friend's anecdotal experience. The key is to approach your next medical appointment as a two-way conversation. Ask about the pros and cons of each medication option, including any new or emerging therapies. Inquire about what monitoring will look like for you and how quickly you can make dose changes if needed. Be transparent about your lifestyle. Do you travel a lot, or do you have trouble remembering to take pills on time? These details can shape the decision, and your doctor can offer practical solutions, such as pill organizers or setting reminders on your phone. Also remember that you can seek a second opinion if you're uneasy or want more clarity. Many seniors feel they should just follow the first piece of medical advice they receive without question. But good doctors welcome your initiative. They appreciate patients who want to be sure about their healthcare choices. You're not being difficult by asking questions or wanting to confirm what you've heard. Making an informed decision can relieve that knot of anxiety in your chest. Instead of feeling like you're gambling with your health, you'll know you've weighed the options carefully, considered your unique needs, and prepared strategies to minimize risks. This sense of involvement can be deeply reassuring, leading to better medication adherence and a more positive outlook. Now take a deep breath and imagine the scenario. You in your doctor's office, calmly discussing your medical history and lifestyle. The conversation is respectful and thorough. You walk out not dreading the next step, but feeling empowered and hopeful. That's the kind of outcome we're aiming for here. A choice made from knowledge, not from fear. If you find yourself still uncertain, remember there are phone lines, online patient portals, and even senior support groups where you can get more information. There's no need to make life-changing decisions in isolation. We've covered a lot: the different types of blood thinners, personalized risk profiles, daily lifestyle tweaks, the value of monitoring, and how to collaborate effectively with your healthcare team. Now let's bring it all together and reflect on how these insights can help you move forward confidently. As you look back on everything we've discussed, it's clear that the fear of uncontrollable bleeding can overshadow the critical role blood thinners play in preventing strokes and serious heart issues. But let's set the record straight. Not all blood thinners are alike, and bleeding risk is far more individual than universal. Recognizing these facts can be the difference between living in constant apprehension and embracing a proactive, secure lifestyle. If you avoid blood thinners altogether because of worst-case scenarios, you might increase your chances of complications like blood clots or strokes, serious events that can threaten both your mobility and independence. By tackling these misconceptions head-on, you're taking a crucial step toward preserving the activities and connections that bring joy to your life. There's no need to let fear make decisions for you when there are strategies, expert guidance, and modern medications that can help you remain both safe and active. So why wait? If you suspect you need more information, pick up the phone and schedule a consultation with your healthcare provider. Ask all the questions that have been on your mind about monitoring, side effects, or possible interactions with other medications. If you're already on a blood thinner and something feels off, request a check-in or explore a second opinion. The goal is not to rush you, it's to empower you. Every month you spend paralyzed by indecision is a month you could have spent living with greater peace of mind. Take a moment to envision your life with a renewed sense of clarity about your treatment plan. You can still garden, travel, or volunteer without the weight of dread. You'll know how to spot warning signs early and how to adapt if your medication needs adjusting. You'll also have a firm grasp on simple lifestyle tweaks, like improving your balance and being thoughtful about diet, that protect you from falls and other risks. If you feel ready to take a big step, call your doctor's office to discuss your medication options or to schedule a review of your current regimen. If you're comfortable with smaller steps, maybe commit to a daily walk that strengthens your legs and stability, or start keeping a health journal to track any bruising or unusual fatigue. You could also share this information with a friend or family member who's concerned about blood thinners, turning your newfound clarity into a source of support for others. Above all, remember that you're not a passive recipient of medical advice. You're an experienced individual with decades of wisdom under your belt, and you have the right to ask questions and make informed choices. Seeing blood thinners as a tool, rather than a threat, can open up possibilities for maintaining the quality of life you value. It's about staying safe while continuing to do what you love, whether that's dancing at a grandchild's wedding or simply enjoying a leisurely afternoon walk. So here's to your well-being and empowerment. Move forward with the knowledge that believing every blood thinner automatically leads to severe bleeding isn't just an oversimplification. It's a belief that can hold you back from potentially life-saving treatments. Embrace a mindset where you weigh the pros and cons, Collaborate with your healthcare team and implement simple, sensible precautions. Your golden years can still shine bright, and with the right information and support, you can protect what matters most: your health, independence, and peace of mind.